You work in surgery now. Did you know this as a second-year PA student?
I did not. So while I was going through my clinical rotations, I sort of just kept a pretty open mind about what to expect, and I wanted to learn as much as possible from the different rotations that I was doing. And it was sort of closer to the very end that I started gathering my thoughts and putting it together as to what I enjoyed and what I did not. And I really liked internal medicine because I really liked the acuity of the medicine and how sick the patients were and how stimulating that environment was. And then I thought about it, and I also liked some of the practical hands-on skills that I was able to polish through my emergency medicine rotation and family medicine, like suture lacerations and incision and drainage and things like that. And so when it came down to applying for jobs and looking at different positions that I was interested in, now that I think about it, surgery was actually a really good fit because it offered a bit of both. It had the inpatient care, the clinical side of things that I enjoyed, and also the practical component, for example, assisting in the operating room or doing some procedures on the ward, for example, wound care and ostomy care, and still being able to see consults in the emergency department. So I think for me, it was a really good fit. Surgery was a really good fit, but I wouldn't have known that had I really kept an open mind and tried to learn and figure out what it is that I liked, and I didn't.
Mm-hmm. And can you describe a typical week in the life of a PA in surgery?
So on a daily basis, I'm pretty much managing the inpatient ward. That wasn't the case when we were initially hired, but now with establishment of medical directives, which are pretty comprehensive, I'm able to manage the inpatient ward with minimal assistance from the residents. So that's on a daily basis. That's an ongoing thing that involves rounding with the residents, liaising with the nurses and the interprofessional and allied healthcare on the floor. So that part of my job is more or less the same on a daily basis. And if I was to look at my schedule on a weekly basis, I have 2 OR days. And in the operating room, I'm either first or second surgical assist. It's cool, and I get to sometimes open and close and prep and drape and sort of overlook the procedure that way. 2 days a week are outpatient clinic days, and there I'm seeing consults side to side with the residents and reviewing with staff as well. And then my 1 day a week is a bit of a catch-up day. And I free up a few hours to either catch up on some of the work that needs to be done for my inpatients, and also some of the research projects and the academic projects that I take on. I use a few hours on that day to get through some of that work.
Mm-hmm. And has this changed over time as you gain more knowledge and autonomy?
It has. So when we first started at Mount Sinai Hospital, and that was 2012, we weren't really sure what was expected of us. Our staff or the supervising physicians are very, very supportive and wanted to see this profession grow, but we hadn't established our niche per se in general surgery. But I find that now that I look back to the 5 or plus years that I've been there, I see my role as having 3 tiers, essentially. So one of them is the clinical, which I've sort of touched on, and second is academic. We're very actively teaching the PA students, the medical students, and even some of the residents. Now that we've been there for this many years and we provide that continuity of care, we sort of know what the different physicians' preferences are, how certain things are managed, more so even than the residents. So we play that critical role in teaching the residents. And then the last piece is the research piece. And I think working with physicians that have a pretty strong research background, I'm able to take on some of those projects that I'm doing currently. And so the 3 tiers to my role that I see at Mount Sinai now are the clinical, academic, and research.
No, that was good. And any tips for PA students aspiring to work in surgery?
First and foremost, I think you just need to really have an open mind. And if you come across your surgery rotations and you really like the environment, or you like some of the things you got to see and do, I would recommend that you do maybe an elective in a surgery, preferentially in a place that you like to get hired or that are very accepting to PAs, so that you can see and get a feel for what the profession would look like. So I think that's one of the things. And then also, if you have some of the skills that I mentioned earlier, being able to work within a team, being a reliable member of the team, and having a keen eye for learning and being adaptable, I think some of those skills would make you a pretty good candidate for a surgery PA.